Welcome to our Meet the Expert series featuring the medical specialists from our Lymphedema United website. We're extremely grateful to all of our experts who help us to live better with lymphedema. In this episode, I introduce you to the fabulous Rebecca Elwell, who is MSc Lymphoedema, Macmillan Lymphedema ANP and team leader at the University Hospitals for North Midlands NHS Trust. And that's not a mouthful at all. Easier to say is she's also a trustee of the British Lymphology Society, or BLS as it's often referred to. So welcome, Rebecca, and thank you for joining us.
Oh, thank you, Matt. Thank you very much. I'm honoured to be here.
We're pleased to have you here. Now, I know that there are two subjects that are close to your heart, that you're extremely passionate about, and they are red legs and the importance of a healthy lifestyle when living with lymphedema. So first of all, let's start with red legs. Can you explain what red legs is and how it differs from cellulitis?
Yeah, so you're right, Matt. This has definitely been something that has really captured my imagination over the years. And I think we're still the only lymphedema clinic that also runs a red legs service as well, as far as I'm aware, which we started in about 2012. So the main difference between red legs and cellulitis is that red legs affects both legs, whereas cellulitis will almost certainly be one side of the body. And we're talking about red legs versus cellulitis. So we're thinking about legs, but actually cellulitis can be anywhere on the body. Can be an eyelid, an ear, a breast, an arm, a leg, a hand. So it is something that tends to be on one side. And cellulitis is an acute infection, rapid onset usually, redness, pain, swelling, increase in swelling, and usually feeling quite unwell, flu-like symptoms, hot and cold, like you've got a temperature, and antibiotics would be the treatment of choice. The British Lymphology Society has a document, a consensus document for the management of cellulitis, and it's just been updated and from October of last year. And I would recommend that any patient with lymphedema gets hold of that document to advise their GP and their healthcare professionals on how to manage cellulitis in lymphedema, which is different to managing cellulitis if you don't have lymphedema.
Okay.
Red legs is when you have both legs that are red, with the redness only going up to the knee. So no redness above the knee. There may be swelling above the knee, but the redness is only up to the knee. And it can still be painful, can still be tender, can still be hot and feel burning sensation. So quite similar things to think about when you're looking at, are they red, are they hot, are they painful? So all those things are quite similar, but both at the same time. One might be slightly worse than the other. That certainly is the case for lots of people. But generally you don't feel unwell unless you're somebody who doesn't feel well. Generally, we know lots of people live with lots of chronic conditions, but usually you don't feel any different to normal. And antibiotics would not be the treatment of choice in that instance.
Okay.
That would be a different medical pathway, because most of the redness and skin changes are caused by either a skin condition, so a dermatological condition, or an underlying vein or circulation problem. And that way, the only treatment that's going to work is the same as lymphedema management, which is looking after your skin, carrying out daily skincare, exercising, using compression appropriately as is applicable for that individual, and also maintaining a healthy lifestyle.
Right. Okay. Now, that's incredibly interesting, the differences that you point out. And of course, there are some similarities as well. What action should we take if we suspect that we have red legs or cellulitis?
So for cellulitis first, let's do that one. Cellulitis is something which can be urgent to manage, and in most cases is. So that bit's the priority. If you don't feel well, one leg, one arm, or one side is red, hot, painful, and different to usual, then you should be seeking medical attention, because antibiotics or a prescription will be necessary. So GP in hours, 111 out of hours, or get yourself to a walk-in centre, or if you're not well, A&E.
Right.
And in the lack of not having any transport, then that would be an emergency call if you didn't feel well. And using that British Lymphology Society guidance for cellulitis is really important, because actually the treatment should be extended for 14 days rather than 7 days, which is often the case for people who don't have lymphedema. And also it might mean that you may be prone to a further infection afterwards. So really important to use that document.
Okay.
Red legs is not usually urgent. People can have the redness for quite some time, weeks, months sometimes. However, it is something that still needs management. So if you think you have red legs, then I would advocate looking at the resources that are available. So the British Lymphology Society has an excellent red legs pathway. So you can look at that and see what would be the treatments that would be appropriate for you. You would still need to seek medical attention, because you'd need to find out what was the exact cause of this redness. And therefore, can that be tailored to get you the very best treatment? Also, we shouldn't be entering into self-prescribing or using compression without having checks to make sure that that's safe for you to wear and is appropriate. So yeah, you still need medical attention, but not in the same urgency as cellulitis. And of course, there's some fantastic cellulitis resources on the Lymphedema United website, written by Professor Vaughan Keeley, who also wrote and is instrumental in the guidelines for the British Lymphology Society for consensus, and also Professor Moffat.
Okay, wonderful. Well, thank you for that. And just to repeat, the BLS consensus document that you refer to for cellulitis and red legs, you can access that from the BLS website.
Absolutely, yes. The documents are free. Yeah.
Like me, yeah.
Anybody at all can download those. So it's free resources that are available to anyone. It's a public website. The British Lymphology Society is primarily aimed at healthcare professionals, but all of the resources that are on the public domain are suitable for patients. And although some of them may contain terms that you're not familiar with, they are to guide your healthcare professionals and GP, district nurse, other hospital consultants, to give them an overview. So if there's anything you don't understand, then please email the BLS or yourselves and ask those questions.
Okay, wonderful. Your camera seems to be slipping a bit there.
I'm sorry. There you go.
And of course, also to mention that this was a joint initiative with the LSN. So
Lymphedema Support Network, absolutely. Yeah. So for
so
patients and the public alike. So it is very much a document that we want to be used by everyone.
Perfect. Okay. And as you just said, just to recap as well, the Red Legs pathway is available through the BLS as a free of charge.
Absolutely. And again, yes, free for anybody to download and have a look at. And that talks you through not only the process of bilateral, both legs being red, but one leg as well. So it mentions cellulitis on there. So you can use that to help guide what might be happening.
Wonderful. Okay. The other thing that we mentioned the last time we spoke was Legs Matter. That provide information on red legs in particular.
Yeah, absolutely. Yeah, the Legs Matter website and all of their videos and resources are fantastic. Lots of information about red legs, about some of the chronic vein change skin conditions. So things like hemosiderin staining, where you get browny pink discoloration on the skin, lipodermatosclerosis, narrowing of the lower aspect of the lid, which can cause real redness at the onset and pain. So definitely check out the Legs Matter resources. Yes.
Wonderful. Okay. And our job really is to ensure that we signpost people with lymphedema, people with potential cellulitis, red legs, to trusted information, which we've touched on. Just to recap, the BLS, the LSN, Legs Matter, and Lymphedema United, which you kindly mentioned, written by Professor Vaughan Keeley and Professor Christine Moffat, because there's a lot of hype and misinformation out on the websites. So it's important that people go to the right trusted site. So thank you for that.
Absolutely. And I think also it's important to realise that the management of cellulitis when you have lymphedema is different to the standard pathway. The actual antibiotics may be the same, but the way in which they're prescribed for the length of time, the requirement that they may be needed multiple times or for longer times, and even to prevent repeated infections is really important.
Right. Excellent. Well, thank you for that. I know that was a whistle-stop tour, but with all the information available, we can resource that in our own times. So let's turn our attention to another subject that forms an important part of self-management for anyone living with lymphedema, me included, and that's a healthy lifestyle. Now, there's myths around that, and the perception is you've got to join a gym and go on a strict diet and lift a load of weights. That's not the case, is it? What do you mean? What's your description of a healthy lifestyle that me and others should be living?
I mean, that lifestyle of joining the gym and lifting weights, if that is you, then absolutely smash it. That's what we should be doing. I think it's really important when we talk about a healthy lifestyle that we think about individuality. So
Mm.
it's about what's right for you as an individual. So being healthy means something very different to each and every person out there. So, and we have limitations. So living with a chronic condition like lymphedema places limitations on your ability. And people live not only with one chronic condition, some people live with more than one condition. So there's always steps that we need to take into account. But maintaining a healthy lifestyle should be thinking about things that can affect our health in a negative way and limiting them or minimizing them. So thinking about our alcohol intake, is there anything we can do to reduce that? If we smoke, is there anything we can do from a smoking cessation point of view to stop that? Can we maintain a healthy eating approach so that nobody's going to eat healthy food all day every day unless they specifically choose to and enjoy that, but actually we should be doing that the vast majority of the time, looking at our resources from the NHS that are out there about the healthy plate, so making sure that we have enough fruit and vegetables, a rainbow of fruit and vegetables in our diet. Those sort of things are really important. Maintaining a healthy weight is important, as is staying active. So we need to be maximizing our potential. So if we are free in movement and can undertake activity, we should be increasing that. So we should always be looking to push that boundary. So could we walk 4 or 5 times a week rather than once or twice or on a Sunday? Could we actually do some resistance training to give us more strength and stamina, whatever form that might take? That might be lifting some cans of beans, or it might be going to the gym and using weights. Can we look at building in some other cardiovascular exercise? Is there a sport or an activity that we could enjoy if we had a go? Maybe swimming. Also, we need to think about those people who are limited with their lymphedema and therefore not able to undertake activities in such a way, or they may have other health problems or other chronic conditions which mean they can't. That doesn't mean to say you can't exercise. So we can be looking at chair-based exercises. So the NHS has some brilliant NHS website videos that are available. So if you type into any search engine NHS chair-based exercises, there's some great videos there. You can look at chair-based yoga, chair-based Tai Chi or Pilates, looking at strengthening the core, and foot and ankle exercises, things that can still promote activity and still promote exercise and engagement, but without needing to be fully active, which is not the case for everyone.
And I mean, there's lots to absorb there, and thankfully it's recorded so we can rewind and press play again. But there's a couple of things I'd like to pick up on, if I may.
Sure.
The first one is, you talk about maintaining a healthy weight. How does being overweight impact on the lymphatic system?
So we know that actually being significantly overweight can cause lymphedema. So that there is a very real link between being overweight and lymphedema. We also know that being overweight aggravates lymphedema. So if you have lymphedema and you carry extra weight, that can make your lymphedema worse. There's an element of obstruction of lymphatic drainage. So if you have a large tummy that rests on your groin, that's not allowing that free flow of fluid. And also we know that there's an inflammatory process that goes on with lymphedema, where there's an active inflammation, and that seems to be worse if you carry extra weight. So it's trying to look at reducing your body weight if it's above where it should be. Now, that might be as simple as making some life changes, like not having a biscuit every coffee that you have, a biscuit with every coffee, might be cutting back on some mild things like alcohol intake, things that are calorific that we don't always think about. It might be trying to make small changes regularly. Or it might be that for some people that's more significant, and it might be needing some support from a self-help group, for example. Some GPs have access to free weight management or prescribed weight management that can help you get kick-started and get going on that. There are some very good groups out there, things like Slimming World and other groups where there's social support, which has proven to be really important. But also, it may be necessary for some patients to have some psychological support and some dietetic support. So, from our dietitian colleagues around losing more significant amounts of weight. And actually, of course, some people do undertake surgery or have medication to lose weight as well. So, it's a real scale of weight loss and weight management. But we should all be looking to maintain a healthy weight for height. And we know that there are limitations. So people will often say, not being able to exercise really impacts on their ability to lose weight. So it's about how can we get that activity. There's a win-win there on both things to try and look at how we can promote that, and also making sure that we access health resources that are out there to help support weight loss. So trying to do something on your own is really tough.
Yeah, and it's not uncommon that some people that are body conscious perhaps don't want to go to a gym, don't want to go to the swimming pool, don't want to train alone, which we can come back to actually, because that's a really important point. But there are some examples that you can give, and you mentioned about lifting cans of beans, for example, gentle exercises to get the lymphatic pumping. And that's important because without us moving, it stays stagnant, right? So we need to keep that lymphatic system working. What other gentle exercises for those who perhaps aren't able to lift weights or aren't able to join a gym can people do from home?
So I think there's loads during the pandemic that's come to light of actually the way in which people can get involved with activity and gentle exercises, as you say. I think the main thing is finding something that you can enjoy. So thinking about things that might fit in with for an advert break, for example. So trying to make sure that every time the adverts come on, if you're sitting and watching a bit of a TV in the evening, that you would do some foot and ankle exercises or some leg stretches or some leg raises. It might be that you enjoy listening to the radio, so you might choose a couple of songs that you make sure you don't sit down during they're on. So average song 3.5 minutes. So that's almost 10 minutes of exercise and activity by just pottering around. And you might even do some dancing. Who knows? Things like heel raises when you're putting the kettle on, rather than just waiting for the kettle to boil. That we take the time to do some heel raises or some stretches. But definitely there is benefit for the lymphatic system for any movement. There is some, but limited evidence, but some evidence that deep breathing also may boost the lymphatics. So again, looking at some of the resources that are out there that include deep breathing. Sometimes this can be as part of lymphedema massage therapy, or it can be seen as a standalone. But even those things may help certain individuals. So I think there's always a way that we can do a little more. It's about finding something that really makes you feel that you'd like to do it.
And I think that's the important bit. We can all do something, whatever that something is. Deep breathing, lifting cans of beans, doing the heel raises. I've started to do gentle squats, just lowering myself so that I get the leg pumping, doing 10 of those in the morning, just to sort of kickstart the day. Admittedly, the first time I did it, I nearly toppled forward, but that's all about building up the core.
It is.
But I'd just like to take this opportunity to touch on my experience of swimming, because we spoke about body conscious, and swimming is a tough one when you've got lymphedema. And I remember it being recommended to me many, many years ago. And I'd go to the pool, and I'd be embarrassed to get changed in front of the other guys in the locker room. And then, of course, there's that embarrassing walk to the pool with your stocking. But I did it because I thought it was the best thing. Further advice, a couple of years later, said, well, actually, you don't need to wear. I got lymphedema in my lower leg, for those who don't know. So my left leg. You don't need to wear a stocking if you're walking or swimming, because the water acts as the pressure. Yeah. So I was advised to walk lengths of the swimming pool without my stocking on. So getting from the changing room to the pool, I just put a towel around myself and chuck it on the side before getting in, and phone them to see when their quiet times were, which was typically between 11 and 1. And they do cubicles, of course, where you can get changed in private. So there are solutions that I found to the embarrassing problem around swimming, because swimming is just so good for you. It uses every muscle in your body, doesn't it? So
Yeah,
I just
it's
want
really good from a
to shift that.
cardiovascular perspective, as well as from a joint perspective. You're taking the weight off the joints, as well as for lymphedema. But you're right, we don't think about adaptations that we can do. So you can actually wear swimming clothes in many pools rather than having to wear just a traditional swimming costume. Now it's quite normal for people to wear more covered up items, which is fine. Like you say, perhaps a call to the pool to ask about that. Taking your towel in is a really good top tip, because people think it's got to stay in the locker, and it
Mm.
hasn't. Using flip-flops or sliders to
Yes,
walk
of
in so
course.
that you're protecting your feet. And also, like you said, times where it's not busy or single sex sessions, people might feel happier in an all male or an all female environment. And I think it is about trying to find ways that means that it works for you.
Mm.
And you did mention there about not wearing your garment when you're swimming and walking. You only meant walking to the pool, because if you were doing activity and walking, then we would recommend that you wear your garment outside of swimming,
Oh, sure.
because
Yeah.
you will get a better benefit from that. But I think that it is, again, swimming isn't for everyone, and getting dried off afterwards and getting your garment back on, that really puts people off.
Yes.
If you've tried to get a pair of jeans on or put a child into their clothes after a swimming lesson, you know that one.
Oh,
But
yeah.
you could actually go home without your garment, cool down, and take time to put the garment back on afterwards. I think that it is, again, about finding something that really works for you, and a way of doing that. But yeah, you're absolutely right. Finding what you love.
Yeah, absolutely. So whether that's little ankle raises or heel raises while we're putting the kettle on, there's something there that we can all do. And to kickstart this, to sort of motivate us into to doing something, there was a campaign, wasn't there, that the BLS ran, which I think every time I looked at YouTube, you were on it. You're a superstar. Uh, tell us about Everybody Can initiative.
So it is exactly that premise, that everybody can do something to increase their activity or their mobility. So it is looking to find those little quick wins. What's your secret weapon? What's your choice? My secret weapon is my Bluetooth earphones, because I love running. So I like to be able to put my earphones in and listen to the music that I love. But it's finding your secret weapon. That might be the kettle, because that's when you do your heel raises. It might be the TV, so that when the adverts are on, that's when you're reminded to do your activity. And it's just finding those little things that work for you, and knowing that we can all do something, no matter how small that might be, to shift a change, and that have that impact, that really positive impact on lymphatic health and reduction in lymphedema. And I think there's little known about the lymphatic system in health. We only think about it when there's a problem with it, but actually we can all benefit from boosting that, ahead of having any problems with it, or hopefully, not having problems with it. The one real key thing that also came out of that, is the promotion through our patron, Trisha Goddard at the BLS, who has had breast cancer and is really committed to activity. Having done dancing on ice, her secret weapon was her ice skates. She still skates really, really regularly, which is incredible, that legacy that's left. She loves it so much. Who would have thought that ice skating would be the thing that you'd find or choose? But also recognises the importance of resistance training as well. And post cancer treatment, for anybody who has lymphedema after cancer, there is not any reason why you can't do resistance training or weight training, or lift those tins of beans, or
Mm.
carry your handbag, or pick your grandchildren up. And again, that's another good document that's available on the British Lymphology Society website, is some myth busters.
Yes.
So things you're told lots of don'ts when you have a
Mm.
chronic condition. Don't do this, don't do that, don't do this. There's very few do's. There's a do put your cream on, do wear your garment, do your activity. And they're all quite monumental things, but the list of don'ts is endless. But actually what we know is there are very few don'ts. We don't want to have don'ts. We don't want to be negative. We want people to do everything and live freely, and enjoy their life and have a good quality of life. So the Mythbusters is a good document to look at, and gets rid and expels some of those thoughts that may not be, people may think they can't do.
Excellent. So I can find Everybody Can on the BLS website, the Mythbuster website, document on your website. And I
It
suppose
is.
what Trisha Goddard has demonstrated is that we can control the lymphedema and not the other way around, that we should take charge of it and say, actually, we can do that. Let's push ourselves a little bit further, as long as it's not going to be risky and, you know, tear the skin or damage the skin that could potentially lead it to infection. But yeah, it's quite inspirational listening to that. So ice skating, my goodness, I mean, I've heard of people horse riding and all sorts of extreme sports that you think, oh my word, really? But why not? You know, if that's what you enjoy,
Absolutely.
you only live once, right?
You do. And for some of the children who have lymphedema as well, you know, they've taught us a lot about exercise and activity, because we used to be really fearful of some of the activities they would do because of sustaining injury. You mentioned some of the wacky stuff, you know, sort of mountain biking and rugby, lots and lots of breaks in the skin, lots of injuries. And, you know, as therapists, it's horrifying when we're looking to minimize that. But actually, you know, we're talking about risk taking, we're talking about minimizing risk, looking at those skin protection methods, wearing your garments to protect the skin when you're exercising, making sure you've got access to antiseptic products if you do sustain any break in the skin, and then monitoring that. You know, we can't prevent all activities, and we want people to be able to do the things that they love.
Yeah, and that comes back to sort of carrying a little emergency pack with you, you know, with the typical first aid items, just in case something should happen. Well, that's been very informative. Thank you very much, Rebecca. It's always a pleasure. But thank you for sharing this information with your usual passion. And for more information about both red legs and healthy lifestyle, visit our website, www. if I can remember it, lymphedemaunited.com. There we go. And click on Meet the Expert, scroll down and click on Rebecca's photo. And that'll take you to information about Rebecca, but also clicking on the articles and blogs. There's a whole section on red legs and healthy lifestyle. And then to visit the BLS, obviously you can jump on their website, but if it's easier for you to do that via ours, visit Meet the Organizations and jump on the BLS section there, and it'll eventually click through to their website. So that's all the information I think we can provide on red legs, healthy lifestyle, some fabulous resources that you've pointed us to. Thank you, Rebecca. It's been an absolute pleasure. Thank you so much indeed for taking the time to talk with us today.
Oh, it's been entirely my pleasure. Thank you very much, Matt. I hope it's been useful. Take care. Bye bye.
Thank you. And stay tuned for more videos from Lymphedema United very soon. Thank you. Have a great time. Bye-bye.